Hello, dear audience. My name is Leonardo and I'm always the host of the ASCAPE vlog. I really enjoy anything that has to do with science, and lately anything related to healthcare. I and my beloved scientist friends are working to improve the quality of life of cancer patients using cutting-edge technologies such as artificial intelligence and big data analytics. Because I'm a genius, I'm going to give you in a very simple way an overview of the state of new technologies around digital healthcare and how we're working to make a leap forward. I've been thinking a lot about what to talk about in our second episode, and the most obvious one is to focus on cancer survivors, their struggles and fears, and on what we can do to make their lives a little easier. For this purpose today, I have as a guest an excellent researcher and entrepreneur. His name is Thanos Kosmidis and has both a strong academic background in IT and business. Recently, Thanos co-founded CareAcross, a digital health company in the UK, focusing on cancer, trying to help patients on their difficult journey toward treatment. Hi Thanos. I know your job involves a lot of contact with cancer patients. Based on your experience, what are the main pains related to their quality of life after treatment?
Patients suffering from cancer experience a large number of daily challenges. Depending on their diagnoses, their treatments, their comorbidities, their overall health status, they may experience a range of problems, including fatigue, pain, hot flashes, constipation, nausea, diarrhea, as well as emotional concerns, such as depression and anxiety, for instance.
It seems that cancer patients have to show a lot of strength in their fight. So, what does it mean for both patients and the healthcare system, if we can improve the current situation? In what direction should we look and work?
What we have been doing so far in the scientific and medical community, of course, is to be very prudent in addressing these concerns, focusing on the patient, listening to the patient, and trying to help them in the best way possible given the circumstances. However, this has not been as structured and as data-driven as it could be. It also has not been evolving and learning as a process through the data and the findings, but also the outcomes of these interventions. If we had a way to actually capture in a patient-centric manner all of these challenges, all of these concerns, the interventions that were being suggested, and the outcome of these interventions, again in a very systematic way, we would be much more capable of actually understanding the comparative effectiveness of these interventions and what works best for what type of patient. If we had that capability, again in a structured and systematic way, it would allow the healthcare professionals and the patients to form an even stronger bond and relationship based on this data and be much more effective in supporting the patient's day-to-day lives. At the same time, the medical outcomes in terms of the quality of life would be improved, and of course one would expect that the costs of the healthcare system would also be contained. For all of this to happen, of course, we need to have the engagement and the involvement of all these stakeholders, and critically, the patients and the healthcare professionals.
Going to the last question, I want to focus on the work of ASCAPE. You are currently conducting clinical trials in 4 European countries. Do the results so far show that ASCAPE can help achieve a better quality of life for cancer survivors?
So at ASCAPE, what we're doing at 4 pilots in 4 very different institutions is engaging with these stakeholders to provide very personalized self-care interventions based on artificial intelligence and big data. So that engagement has already given very, very promising signs that the benefits of a structured, data-driven approach can really scale up and can really support both the patients and the clinicians in their workflows. And we have early indication that the long-term value of these learning systems can really make an impact on each individual patient's quality of life.
That's all for now. For the next episode, we will talk about legal stuff. Fear not, we will break down in the simplest way what our rights are as patients when we provide our data and what we can do to protect it. Talk to you later then. Did I tell you to follow me on social media? ASCAPE has accounts on LinkedIn, Twitter, and Facebook. You can also find a ton of material on our website to get into technical details about related scientific fields and even ways to contact us. So far, you should know that I work on a project funded under European Commission's Horizon 2020. Of course, I cannot do everything by myself. In ASCAPE are participating 15 organizations from 10 European countries involving big companies, SMEs, research centers, universities, and hospitals. As a result, I have all the expertise that I need.